Because when you augment that intelligence to the human beings that are already doing the job, they don't have to do the mundane stuff that nobody should be doing.
Right.
And then all of a sudden their productivity goes up, their satisfaction goes up, and their ability to do higher cognitive stuff goes up.
Welcome to Revenue Cycle Above the Bottom Line, the podcast where we dive deep into the world of revenue cycle management. I'm your host, Tim Reiner, and in each episode, we sit down with industry leaders, innovators, and experts to explore challenges and strategies shaping the future of healthcare revenue cycle. Whether you're a seasoned professional or just starting out in the field, this podcast is your space for thought-provoking conversations, actionable career learnings, and discussions about the latest trends you need to know about. Thanks for tuning in, and let's get started. Today, we sit down with the president and CEO of Apprio, a leading healthcare technology company. Kali, thank you for being on Revenue Cycle Above the Bottom Line.
Thanks, Tim. Thanks for having me.
Before we jump into your current role, tell me a little bit about your background. I understand you started as a software engineer.
Yes.
Is that right?
Yes. Yeah. So I came to U.S. in '98. I did my engineering in India. Came here in '98 to do my master's, and then I joined Sprint, a telecommunications company, for the first 3 years of my career. But after that, it's been all healthcare.
So how did you get into healthcare then? So you went from telecom to healthcare at this point. So how did you make that transition?
So I would say healthcare actually largely picked me, and I stuck to it because that's what I know. So my journey has been that out of my 3 or 4 jobs, there's only 1 or 2 that I had an interview for. Otherwise, my previous manager took me to the new job. So one of my directors at Sprint went to Eclipsys, which is Allscripts, and said, "Hey, come on by, we have a job for you as senior software of ambulatory." And so I joined as a senior software engineer of ambulatory in Eclipsys in 2003, and never looked back from healthcare.
So looking back at your kind of diverse career, who was another mentor? Was that one of the most significant mentors, that first manager, or what was another notable mentor?
I would say a lot of mentors along the way. But my biggest mentor actually came from Eclipsys, and he was with me for over 9 years. And he taught me how to be a leader, not only an engineer, from that standpoint. And the most important thing that he taught me was it's not about the what, it's always about the how.
And what kinds of things were you working on during that healthcare? Eclipsys did a number of different things, as I recall, but was that rev cycle at the time, or were there some other things they were into?
Out of my 22 years worth of career, about 17 of that has been on the clinical side.
Okay.
So EMR, documentation. So I learned everything I learned about healthcare from all the way from scheduling to documentation to order entry and all of that stuff until about I joined Zealous, which is the revenue cycle side.
Tell me a little bit more about that current role. So you talked about transitioning from Eclipsys to Zealous, who does the kind of back end of the payer side of healthcare, and then now to Apprio. What's your current role at Apprio and those responsibilities?
So I went from Eclipsys to Nuance Communications for speech, AI, ML.
Yeah.
Then I went to Greenway Health, learned all about being the CTO for ambulatory care. And then Zealous called and said, "Hey, we are doing something on the revenue cycle management side." And I was like, "Okay, sure." When I went there, it was very obviously one of the most complex things I've ever seen, because when I didn't realize that when a bill from a provider goes to the payer, it roughly passes about 17 systems before it's adjudicated.
Is that right?
Yeah.
I believe it.
And Zealous was only 4 of those.
Yeah.
So I was very fascinated with that, and on how to simplify that aspect of it. And I was at every point of the career, I was pretty happy where I was, doing what I was doing at Zealous. And then the founder of Apprio called me one day and said, "Hey, we're doing this new cool automation thing, and it's in revenue cycle management, and we have this great client in Advent. We'd like to come run, be the president of the company." And initially I said, "Oh no, I don't think I'm qualified to do that." But then, I slowly got into Apprio and, learned what they were doing and was super excited about what they were doing. And so it's amazing journey. And so last year and a half has been just an amazing amount of learning and growing. And I never thought I would be able to even come close to doing it. But it's been a great blessing.
Yeah, very good. You mentioned something about the complexity of how many systems that healthcare information passes through. And we were just talking about like basically a claim, right? You're
Yeah,
talking about the payload of a claim. That doesn't even include all the clinical data
that
that's
is
out
correct.
there. So why do you think it takes so many systems? Is that because just over the last 3-4 decades, there's just a lot of technical debt and it really needs to get down to a couple of systems and payers will eventually get there? Or is there some other kind of mitigating circumstances?
Technology just is adapting to what is the ecosystem and the regulatory and what is the process, so to speak.
So how do you balance the need for kind of innovation with those practical demands of healthcare? So you got to keep some of the lights on, but then push towards innovation.
Innovation to me, even when I was VP of Innovation at Nuance, was never about one big thing. It's always about small incremental steps that you can do in each of those mini processes, so to speak, in innovating, right? So it's always about continuous improvement. It's all about those small steps that you can take. Because yes, there is also a big thing where you can dream up some big aspects of it. Yeah, and those will come once in a while, but those won't come every month. Those won't come every day. Those won't come every year. So in the meantime, you have to constantly keep improving and innovating on the small stuff.
So what's your long-term vision for the role of technology and kind of transforming that revenue cycle, like in your role?
One of the new things that is happening that's exciting in my field is so the robotic process automation, which is RPA, and plus now with AI, is now turning into something called agentic process automation. So you can not only automate the current processes with you can not only automate the current processes with regular RPA, but you can actually now use AI to use more agentic process. Agentic process simply means that I'm actually helping the agents do their job better. I think there's between the RPA and between the agentic process, if you look at RCM processes, there's a whole bunch of processes that are done, which needs to be automated. And then there's the agents that are working with, whether it's the patient or the consumer or the payer. And so now if you augment all of this with more automation and more technology, you can see where, out of the $3.2 trillion healthcare system, 10% of them are administrative tasks on the RCM side. So even if we are able to tackle 20% of the 10%, it still accounts to about $70 billion in savings.
The kind of concept of having like a digital worker is, largely that kind of RPA concept. So what you're describing is kind of making those human workers kind of more efficient and more productive and that sort of thing.
And it's actually not, there's two aspects to this. One is that by providing automation technologies, you're actually allowing the humans to do what they do better in cognitive functions. So by doing automation, and allowing the automation to help augment. So it's not artificial intelligence, it's augmented intelligence. Because when you augment that intelligence to the human beings that are already doing the job, they don't have to do the mundane stuff that nobody should be doing. And then all of a sudden their productivity goes up, their satisfaction goes up, and their ability to do higher cognitive stuff goes up. So in our lives, for example, one of the things that is a classic example is if I allow you to do less status reporting, less expense reporting, less tax reporting, think of how productive you are and what you can do with that aspect of it.
So you mentioned that term RPA, robotic processing automation. Can you give like another example of like how meaningful that contribution has been like for, your clients?
I don't know if a lot of people realize, but when we do our RPA, robotic process automation, last year we ran 70 automations 2 million times that eliminated 70 million tasks.
Wow.
So those 70 million tasks equate to 120 FTEs. One example is when I rolled out some of the automations in my past job, one of the jobs was to open the mail and feed the document and make sure that the document is fed right or type that into the system. And when we took that away and automated that task, the people were unbelievably happy because they were like, what do you mean? I don't have to now enter all this system again and enter all this information into the system. And so now I can actually verify that this is actually right and actually do the higher cognitive stuff, like making sure that it's right, making sure that now the dollar amounts are right, or making sure that the next step process is done better.
So how do you ensure the technology like stays adaptable to the changing regulations and industry trends? We talked earlier about like the regulatory framework being pretty complicated. So like how do you kind of make sure that technology follows that?
This is where I believe in AI coming to the fruition of. So AI has two needs, right? One is AI helping consumers directly. So, the chat GPTs or chat GPT versions of it in our jobs, are helping us. And, if you roll out enterprise chat GPT or some things like that, or even AI-based programs that are helping the RCM and any others. But there's an internal benefit for AI. That's where some of these changes will come in. I can use AI to code better and adapt better. So instead of having half a dozen developers redoing some of the code because there's a regulatory change, I can use AI now to even enhance that by 20% or 30%. I'll never have AI to replace all 6 people, like 100%, but I will always have AI to help me with 20% or 30%. And that's where I think most of the benefit from AI comes, is that if you think about the amount of time that is being spent by, I think we have about, 3 million software engineers in the world. And if I take away 20% of their productivity, or give them 20% of the productivity back, imagine how many more applications can be done.
So what technologies or tools have had the biggest impact on improving the revenue cycle process in recent years? I mean, you probably will answer AI, but is there anything else that folks wouldn't really think of?
One of the technologies that is very surprising to revenue cycle management that I never thought I would hear is ambient technology.
Okay, yeah.
So I worked on ambient technology on the clinical side, with putting a microphone here and there, allowing the doctor and the patient to have a conversation. And all of a sudden, at the class conference last year, I got into this discussion on ambient, how ambient helps revenue cycle management. That was very surprising to me. And you know why? It's actually true, because if you can impact higher quality documentation right at the gate, and involving the patient and the doctor, it will help the back-end process of the revenue cycle management.
Yeah, it helps our coding because we get better documentation and better diagnosis capture, better clinical, decision making, all that stuff.
If you impact something up front with higher quality, obviously the back-end will mature and benefit.
Before we continue, we wanted to thank you for tuning in. If you have questions or thoughts or just want to say hi, we'd love to hear from you. Send us an email at revcyclepodcast@adventhealth.com. That is REVCYCLE podcast@adventhealth.com. If you enjoyed this episode so far, be sure to like, subscribe, or follow so you never miss a new episode release. Now, let's get back to the rest of the episode. What are the most significant challenges like you've faced as a practical matter in developing like AI-based revenue cycle technology?
We still are, by the way, are nowhere close to fully automating everything and fully using AI into this.
Yeah.
So I would say we're still in the early stages of using it.
Yeah.
And obviously the data, the cleanliness of data, the availability of data is a big deal. When you come to large language models and things like that, on how accurate they are, how reliable they are, where that is coming from is always a big deal. And so I wouldn't say we have even cracked the beginnings of AI into it. But having said that, we've started to use small machine learning language models to start impacting denials, for example.
Okay. And so what kinds of denials? Like taking and like drafting appeal letters, or taking certain actions based on the denials, or like it's like reading a letter or reading through a remittance and figuring out the denial?
One of the examples that we're trying to do is, can we tackle contract changes in real time, for example? So can we, because otherwise there's a set of rules that you develop based on the current contract, and when it changes, you have to change those. But can we react to it in real time by, doing the contract language, extending that model to the contract language? Now, that's one example. The second example would be where you obviously, a lot of providers know what their top 10, top 20 reasons are.
Yeah.
But can AI come from the bottom and actually figure out the bottom 50 reasons and figure out how to get rid of those? Because nobody's working on those from that standpoint, and those are the easy ones. And even if we're able to impact 10% of those or 20% of those, that still converts to a huge amount of insights.
So what innovative solutions or technology are you excited about to help that problem there, the prior authorization and denial challenges? Are there other things?
So see, this is where I actually veer away from a technology a bit. I think the challenge is in the not doing prior authorizations and denials. So my belief has always been and regardless of small problem or a big problem, you try to constrain the universe pushes back. You try to not constrain the universe, it actually grows. And so eventually it'll come back down. Same thing with denials. I don't think the onus should be on payers or providers. The onus should be actually on the consumers from that standpoint. So I'll give you an example. In India, the insurance is now coming up slowly. The payers are coming in. But for majority of my life, consumer was responsible for the decisions.
Yeah.
Where I went, what I got was all my responsibility. Yeah. There was a charge card. If I was able to afford that, I did that. If not, I didn't. Even today, the payers and the consumers are working together to say, hey, how about we together make a decision that's both right financially and clinically. Yeah. And when you do that, all of a sudden, you're like, and of course, there has to be something in it for all of us, to do. So I would say, now, having said that, if I really have to solve it from a technology standpoint, I would solve it by using AI, by using automation, by taking away everything that should not be done by human beings, and actually machines doing some of the decision-making aspects of it.
Is there any other kind of technologies that you think could improve that appeal process, like we talked about with prior auth?
The agentic process that I just talked about. So if I take the pure process automation thing, combine that with the agentic thing, because appeals process is usually agentic, right? So somebody is contacting somebody about some more documentation versus, and then there's back and forth, and so that all can be automated from that standpoint. And so I would say I would go back to my RPA plus AI equals agentic process automation.
It seems to me that there's one of the ways that you could do it is almost like using like a blockchain to settle the claim or appeal. So you had a set of rules that different, let's say oracles or different decision making would agree on, sort of like a voting process. And then, we could all, between the payer and provider, say, okay, we accept that sort of independent appeal verification. Otherwise, it just becomes we inherently as providers think that the payers just saying no because of some bias, right. Being able to take a kind of third party to call balls and strikes, or I'm using a baseball metaphor. I don't know what that would be in cricket or something like that. But how can we sort of get down to an objective, clinical process that sort of decisions those items? I don't know that there's a solution for it, but that's the way.
But there again, I think we can follow. Technology can totally do that if there was a third-party adjudication system that can be agreed upon. So the agreed upon is the big problem, right? So because again, once you agree upon it, for me to bring the technology is the easiest part. I can use AI to even fast track it by 20% or so. One thing you do bring up though is that real time. One idea that I have that is probably game changing would be real time claims, payments, and adjudication process.
Yeah. It's done in the dental world and in the pharmacy world.
Exactly.
Right?
It's done in the banking world. It's done in everywhere else except the healthcare world. And I think by not doing the real time, you are now creating more processes and more hurdles and doing it. So whenever you convert it to real time, I think either the decision will happen or not. We may not all agree with it, but at least it's done and it's paid and it's all settled. It's a huge consumer satisfier too,
I think so.
and payer satisfier and a provider satisfier too, and so I think that would be a game changer for me in my mind.
I agree with you. I mean, they used to talk about that back in 07, 08, 09. I remember Availity was talking about it. Some regional players in Indiana and others were doing it, and it's just kind of gone by the wayside.
Yeah.
Nobody talks about real-time adjudication anymore.
And
it was happening at small scales and with doctors' claims, with physician claims at a certain point. But I think it's largely not in vogue anymore.
Yeah, I think we have to bring that back because that's the only way to solve some of these aspects of it. And if you think about it, a real-time claim is just a a new a claim that is happening in, it's the same thing. It's just happening faster. And even in the other example that we were talking about offline was this advanced EOB thing. Advanced EOB is nothing but an EOB that is happening now in a framed up.
The service
Exactly. So I think today, I think the hurdle is not technology, the hurdle is the mindset.
So as a revenue cycle team, like here at our organization, we're trying to move from what we've called for years like a world-class revenue cycle to becoming a preeminent revenue cycle. So that kind of means like going from really good to great. So what does that like preeminent goal mean to you? Like what's your perspective on how that can come about, and what's the role of technology in it?
Yeah, I mean, this conversation is a great example of preeminence, right? I've worked with probably hundreds of healthcare organizations in my past 23 years, and this is the first time I'm doing a podcast like this. So this is one example.
Yeah.
But the other example is just the one where we talked about where if we can come together to solve both the policy and the technology issue, that would be one other aspect of it.
Yeah.
And doing what and knowing living in this area, knowing what Advent is doing, and being associated with you for the past few years has been a great experience. And I think that's what preeminence means: thinking ahead, thinking differently, trying to solve the problems that nobody's solving, trying to think of issues even before they happen.
Yeah.
Or trying to come up with the real-time stuff that we're talking about, and actually collaborating with everybody to bring that back up.
Would you say that there's any kind of saying or any kind of advice that one of your mentors gave you that has been something that has stuck with you and that you kind of live your life by?
Yeah. So one of it that's always stuck with me is top of any hill is the bottom of another one.
Okay.
Just keep looking up and keep climbing.
So you've dedicated yourself to kind of the 3 H's: humble, happy, and honest. How do you think that's impacted your professional development?
My professional development has always been adding value and doing whatever it takes. So I would never care for titles or roles or anything like that. And if you called me today and said, hey, your job is to move a box from here to Tampa, I would gladly do it, without question. But that's a small example. The big example is at Eclipsys, I had one role per year for those 7 years. I did something very different. I did software engineering, then I did partner management, then I did innovation, then I did in the field job where I was an implementation manager for a year. So those are, and being there and saying yes to anything that came across to me was the biggest blessing in my life.
Before we wrap up, we asked our previous guests to give a question to you. So that question's, what is the most difficult thing you have ever had to overcome in your life?
I would give you one work example and one personal example. So when I went to, so I stood in line for a visa in 1997 at midnight, the night before, and 200 people were let in that day, and only 4 visas were given.
Oh, wow.
So I just happened to be one of them.
And what do you chalk that up to? Luck?
That's
God?
Blessing. Yeah, it's complete blessing, right? So, I mean, my whole life is a miracle to be here, to be doing this from where I came from. And so that was an important turning point. One other personal example was I came here with a negative $2,500 loan, from the bank to do my first semester. Okay. And my dad said, that's probably all I can do for you, as a bank officer with only couple $100 a month job.
Yeah. And
then I came here and I realized that I cannot get this scholarship for the second semester, so I had to overcome that by actually creating my own scholarship, so to speak, because I went to the dean and I said, hey, we are a computer science department, we don't have a lab. Can we do a lab? I will monitor it, I will manage it, and all you do is give me in-state tuition, and they agreed. So, so I had to create my own scholarship, so to speak. Otherwise I had to go back to the country.
We've had a chance to talk a lot of things today and make a bunch of connections. But would you leave the audience with anything else as far as our conversation? Any final thoughts?
No, I mean, I think the final thoughts is, it's just all relationships are a blessing. Every day is a growing and a learning day, and so I would leave us with a place where, I come from a country where we didn't have much regulation, we didn't have much prospects, And as much as we complain about systems here, we complain about things here, we're still the number one country in the world. We're still number one in healthcare. We are still number one in many aspects of the world. And so I would say take the big picture and see where we are, and just appreciate where we are as a country, as a race, as a human entity.
Yeah, those 3 H's again: happy, humble, and honest.
Absolutely.
Did I get it? So, Kali, thanks so much for joining me today. I really enjoyed our conversation.
No, thank you so much for having me. It's a complete pleasure.
Thanks so much for tuning into today's episode. Make sure to like and subscribe to our channel.